All right, welcome back to AI for 2021. I hope you're enjoying the session so far. Our next panel is titled Healthcare's AI Transformation, Diagnostics, Automation, and More. Please join me in welcoming our panelists to the virtual stage. Awesome. Hello, everyone. Welcome. We're so excited to have you here today. My name is Patricia Elise. I'm here with the AI4 team, and we're so excited to introduce today's panelist. So let's get started with some introductions. Jeffrey, would you like to kick us off?
Sure. Hi, everybody. I'm Jeffrey Eyestone, a healthcare industry and solutions leader at CognitiveScale. We're an AI software platform provider with solutions that drive care optimization, service experience, claims transformation, a lot more use cases that we'll talk about in today's session. And we're doing this for some of the largest health insurance companies, integrated delivery networks, and healthcare systems in the country. Looking forward to the panel. Thanks.
Looking forward to having you. Thank you. SIna.
Thanks, Patricia. My name is SIna Bari. I'm a plastic and reconstructive surgeon by training, and I am also the director of medical AI at a company called iMerit, where our focus is creating large-scale training data sets for machine learning use cases, both on the clinical side and on the operational side.
Very cool. Stephen.
Hi, I'm Stephen Wong. I'm a scientist and chair professor, but also hold some administrative role at Houston Methodist as a center director and CRIO. I have about 3 decades experience in medicine, healthcare industry, and academia. Before joining Houston Methodist, I was a professor at UCSF, and I involved to build the first PAC system at UCSF, also heading the global integrated clinical product development for Philips Medical Systems. Thank you.
Awesome. Thank you. And finally, Craig.
Yes, hi. I'm Craig Richardville, Chief Information and Digital Officer at SCL Health. We're a multi-state IDN based out of Colorado, and it's a privilege to be here.
It's a privilege to have you all. We're so excited to get started. So let's jump right in with our first set of questions. So our first question is, some say healthcare was a bit wary when it came to adopting AI for different use cases. Do you agree? And where are we now in terms of adoption of AI in healthcare? And Jeffrey, let's kick it off with you on this one.
Sure. Yeah, in terms of wariness and skepticism, absolutely. At CognitiveScale, we've been at this for over 7 years, and our founders come from IBM Watson, so they have a lot more heritage in this area than I do. But certainly, when you look at healthcare and talk about, say a machine augmenting the intelligence of a clinician, there's going to be a wariness there, skepticism. Even those administrative and operational use cases, models need to be accurate and explainable. So I would bucket this in 2 broad areas: trust and technology. That wariness on the trust level. Over the years, we've seen instances where models have been shown to be biased or lack explainability, having a hard time convincing clinicians. Some pretty high-profile cases there. And then obviously, in terms of accuracy, you have to address that even in more operational use cases. And then, of course, there are technical issues, having the data available to light up AI use cases. I know some of our panelists can speak to that better than me, but that technical wariness as well, everything it takes to develop, deploy, operationalize, and then realize value from AI solutions. Folks have been rightly skeptical about that. We'll dig into some of those challenges later. But over the years, I think by now, the last few years, we've seen most healthcare organizations taking on those technical prerequisites, recognizing the risk and the trust issues, and really adopting AI in lots of areas that I look forward to hearing from my fellow panelists about.
Wonderful. And kind of sticking with the more technical side, Craig.
Yeah, one way that I'd like to kind of respond to this question is really just helping to maybe define a little bit about what AI is and maybe what it's not. Artificial intelligence, when it first started to gain a lot of press, I think we're very much in our infancy of its actual utilization, but I think it's going to accelerate very quickly as a lot of these use cases really start to come to life. I would like to tell people it's not really artificial. It truly is intelligence. It's knowledge. It's things that will complement the human and their behaviors and how they want to proceed and move forward with it. So I think, when I talk to people, it's like a GPS, right? It's like in the simplest form, a GPS will reroute you depending the time of day, the traffic patterns, et cetera. And how many people would want to go back to a map? Very few. So the fact that you're adopting this in your personal life, I think will now to translate into your professional life, I think it'll become more and more not only acceptable, but actually demanded that we need that to do our work better.
Great perspective. And Stephen, what are your thoughts here?
I agree with Craig and Jeffrey said. I think we are still in the early days, I would consider. But bear in mind, as Craig said, what's AI? AI has been keep changing. Herbert Simon used to say, one of the founder AI say, once you find out this AI, then we consider it's not AI. So in fact, there are a lot of AI have been implemented in the healthcare system. The early days, tech short-lived type of rule-based system has been implemented. The AI we're talking about today is about deep learning, machine learning. That, yes, that's still early stage for the clinical care side. But I think a lot of them has been embedded in the back office type of situation more than what we are aware of. They become so smooth, go inside there, people don't advertise this AI system. So I will look at it, I'm more optimistic. Yes, we are early on in terms of patient care, but in the back office, in fact, we embed a lot of AI into it already. Yeah.
Definitely. And SIna, what's your perspective here?
Yeah, I think, I think it's well said by the other panelists. The thing that I would add to that is that I don't think that this trend of a conservative approach is unique to AI. I think when we look at technology in general, whether it's digitization or adoption of mobile technologies, that healthcare historically lags behind. And we'll kind of get into some of the reasons for that, I think, in a little bit. But one of the things that I think of from a clinical perspective is the fact that we have as an oath, as a mandate, as a part of our clinical practice to first do no harm. And so just by reasoning of that mandate, we are, we consider our baseline to be non-intervention. So there is a conservatism to that. In addition, I think, whether you're talking about a full inpatient census or you're talking about a busy operating room or a busy clinic, there's an aspect of medicine that is very dependent on heuristics and very dependent on sort of that fast thinking. Kahneman won a Nobel Prize describing this, but that system one thinking, that's like a flow state. And so as a technologist, when I wear my technologist hat, I'm thinking, disruption. But as a clinical practitioner, I'm thinking integration. How do we introduce these technologies so that they integrate as a part of the workflow? As an overall sort of benchmark of where we are, I think we're moving from R&D into early commercialization. There's a sense of inevitability to AI, just because the value proposition to payers, to patients, to providers is just so strong.
Wow, that's an excellent perspective. And that actually leads us very well into our next question. What are some examples of impactful ways that AI can enhance patient outcomes in healthcare settings? And of course, the more the merrier with the examples that you can share. And SIna, I'd like to stay with you for this one.
Sure. So I think one of the things exciting about the work that I do is that by creating training data, we get exposure to a lot of different use cases, especially in the sort of unstructured data realm, both for computer vision and NLP use cases. And so digital radiology, I think, is the most mature space within that. It's leading the way in terms of what ultimately will translate to patient benefits and patient outcomes, both for diagnostics, but also for triage and workflow management. There's just an amazing amount of innovation that's going there. I think digital pathology is an area of high investment, specifically for pharmaceutical companies. That will also, along with applying it to structured molecular protein data, will be sort of transformative. As a surgeon, the one I'm super excited about is applications within robotic surgery and endoscopy. And then on the NLP side, we're seeing advancements in clinical decision support and conversational AI to guide patients.
And thank you. And Stephen, I'd love to get your perspective here as well.
I agree with SIna say, but I have a slightly different idea. It definitely, the AI is definitely in the pattern recognition profession of medicine. It's advancing a lot. Since SIna talked about digital radiology and digital pathology, I think digital pathology for me is more academic exercise at the moment. The reason is radiology is completely digital workflow. You put a patient in the scanner, everything digital. Pathology, you still need to prep the tissue, scan the tissue, digitize tissue, process tissue. If you ask the CIO who's paying for all this, it's a good luck. There's no reimbursement. So it's good for pharma to build up a database to test their drugs, but it's not for clinical use anytime soon until we have real digital acquisition of pathological symbol, like optical biopsy. We haven't get to that stage yet. So far, I feel digital pathology is exciting academically. We have a lot of digital pathology project, but it's stay academic, funded by NIH type of thing. I don't see in the clinical application anytime soon. Remember, a digital pathology image itself easily 10, 100 times more than a digital radiology image. Talk to CIO about his budget. I mean, he just jump up the roof, you know, just all these things. So there's one thing I didn't mention. The other area I think is, we are at the end of the day. I mean, all these examples are all promise. So far, we have a lot of have some product coming out. You know, you have, for example, you have this radiology. You talk about radiology. IDX, the diabetic radiopathy screening is already approved by FDA, right? You talk about the orthopedic, right? You have this OsteoDetect. I mean, the risk factors also approved. There are many approved. Stroke also have many of them. So it's coming. FDA start getting a hold of how to certify AI. And it's coming that way. And now the issue is FDA approved doesn't mean you make money, right? So we have a lot of reagent approved for imaging Alzheimer. Doesn't mean that CMS willing to pay for it. Those are another hurdle is really about how this application, sooner or later, this application have to be tied into the return on investment. Otherwise, they will just die off. It will become just one-off solution. So something that is promising, is exciting. I just don't know. I mean, we have done a lot, even within our hospital. We readmission, for example, a couple of apps. One of them is COPD, using readmission day one, and we reduce in 3 years, we reduce 45%. But I think refer to Jeffrey's question earlier on, is a trust. Really is about the current AI is so data hungry, hard to get the data correct. I think SIna mentioned about do no harm, right? We're scared of training a AI model with wrong data. I think that's make us slow down a lot of things, in a good reason. So labeling, if we have a way to automate the labeling effectively, I think we will speed up the deployment a lot.
Excellent. And I know you'll have a lot to say when we get to the challenges question later on. Jeffrey, what's your perspective here? Anything to add?
Yeah, I think, you know, those are some tremendous responses from our medical doctors, obviously. Where I would talk about, you know, care optimization and improving patient outcomes, similar to Craig's GPS analogy, we talk about a Waze-like experience. And I thought that was a great analogy because it's not just identification of at-risk members or patients, you could have hundreds of models that predict surgeries or events or conditions, complications, all those sort of things. It's how do you alter that journey? So optimize various missions through care protocols, for example, or care journeys, and then develop predictive, personalized, proactive interventions direct to a member, a patient, to their providers or caregivers through all sorts of different channels, right? Through, again, their providers, their clinicians, but also nowadays apps and call centers, contact centers. So there's a lot to do with AI around the more clinical models that actually identify members or patients for risk. But then how do you really drive that goal-driven campaign that changes the outcomes? That's a lot of what we're doing for some of these organizations, some of our clients.
It's very exciting work. Yeah, go ahead.
I think those are just great points, and I love the examples. It's, for me, it's kind of like how we're continuing to evolve at a rapid pace, the art of healthcare delivery into the science of healthcare delivery, where we've got best practices and patterns and things that people can continue to learn from each other and put into place. I think from the patient standpoint, we all saw this during the pandemic last year, just easy things like a symptom checker, things that would help people self-diagnose maybe where they need to go. And the same thing in terms of care delivery. Do they need to come into a practice? Do they need to go into emergency department? Can we believe it can be handled via virtual care and attached that way? And I want to go back to one of Zina's original points. Virtual care to me it's just care, right? The virtual part to me kind of gives it a little bit of a nuance that maybe is a little bit different, but the intent is that you have the same outcomes with easier access. It's not a different level of care, it's just a different method of how we're delivering that service. So all these things kind of tie back in together. And as we continue to, I think, maybe standardize a little bit more, as we continue to work with the science part of medicine, that really will help us transform and move ourselves into another level of outcomes. The conversational AI one I find very intriguing because I'm a big voice person. I think voice is the next user interface, and obviously many of our tools today listen all the time. But the conversational piece, we're going through some proof of concepts and some pilots, what I like to call it early adopters, because we're moving forward with it, but people have the choice to participate in it or not. We're finding somewhere between around a 40% hit rate, that of all the providers that have so far been in the first cohort, about 40% of them want to continue with that aspect of it. The other 60 really have a different method, a different way of how they're documenting their visits and their cases, and really don't see it at this point, but it will continue to improve. And I would hope over the years you would see more and more of that happening, because it relieves some of the administrative burden of a provider to allow more of a work-life balance, or maybe more of a focus to spend more time with the patient versus documenting, the actual visit with the patient.
That's an excellent point. And I think we can actually stick with this kind of technology and streamlining processes topic with our next question. So what are some examples of how AI can enhance back office operations in healthcare organizations? And of course, we love these examples, so keep them coming. Craig, would you like to kick us off on this one?
Well, this one is one that I think one of the panelists commented on, is a little bit fat, because it's really, many of it is not really healthcare specific. It's across all industries. So a lot of the back office work has already started in different areas. Several things that we have worked on and are working on, and one is propensity to pay, to make sure that we actually individualize how we relate and contact with our patients, so that we don't treat everybody the same. And those that might need some additional assistance is a different approach versus those that might not need some assistance with their ability to pay for the bills. So that's kind of one piece that we're looking to really create more of a, you could say, kind of like an Amazon, a personalized kind of experience. Another one is RPA. That kind of fits a little bit in the digital, a little bit in the AI side, but that robotic process automation, and that really is just removing all those repetitive tasks that we have. That becomes, as we get into the challenges, a little bit of a challenge, because it is a threat in some cases that we are starting to replace things. However, there's more advanced and higher level work that people can be reassigned or repurposed to. But you're seeing that in revenue cycle management, supply chain, our whole procurement and purchasing and accounts payable. There's a lot of opportunity to make that more efficient and effective on the back end side.
Excellent points. And Jeffrey, I know you'll have a perspective here too.
Yeah, no, this list is as long as my arm, and I'm glad Craig covered a few that that we touch on as well. Certainly on the provider side, there's propensity to pay and rev cycle. Why might a claim, deny, short pay, late pay, a patient not pay, all of those sorts of things. Where that plays out on the health insurance side, of course, claims transformation as we move towards increasing auto adjudication rates, like Craig said, with process automation, we talk about RPA to IPA, so an intelligent process automation layer that then allows you to orchestrate, not only the exceptions and adjustments automation, but maybe real-time prepayment, fraud, waste, and abuse use cases, and lots of other transaction processing upgrades, if you will. So there's just a tremendous amount to do there in that part of the back office. Another area we touch on quite a bit is in service experience. So, an ability to predict member, patient, or provider service inquiries, and then have highly personalized, contextualized insights about how to resolve those can save all sorts of money, drive satisfaction, and even get into things like care optimization. So call centers or contact centers can, then take on all sorts of other AI use cases, appointment reminders and prescription compliance, use cases like that. And then in so much as that, those insights can be omni-channel. Again, like Craig said, things like conversational AI or proactive notifications and alerts. How do you surface those insights across multiple channels? Orchestrating that is a big part of what our platform does for our clients, but enabling all sorts of different conversational AI tools to leverage these insights is a big part of what we do. And then there'd be lots of other administrative AI use cases as well. But again, I can go on all day about this list. Those are some that are top of mind on top of Craig's list.
Awesome. And Stephen, what's your perspective here from the more medical side?
Yeah, I totally agree with Craig and Jeffrey. I think the back office operation or administrative cost is really the low-hanging fruit the AI should attack first. Because you are not dealing, it's okay when I talk to someone, screw up, so what? I'm not killing anyone. When I talk to diagnosis or treatment, is something go wrong, it's very life and death for the patients. So I think the administrative is a good way to get started. And it also makes sense because United States, we actually clear outlier in administrative cost is unproportional, ridiculous. I think the one advantage, Jeffrey mentioned it, is fortunate there are also many other industry working similar problem. So we can borrow it into our area. So we are not alone in healthcare industry. So I think I totally agree. This is back office, a good area to go in. I think we should hit something quickly. But I have another point is technology can only do so much. You can't, if your policy screw up. You look at our processing, our billing insurance process is so convoluted. We don't have centralized processing. And come out of our country, how much automation you have? Remember, they're so convoluted. The risk of error is high. So be careful in the billing. So I think you have to go both ways. I mean, this is outside the scope. AI can do something, but administration is to consider as some sort of processing cleaning house to alleviate a lot of this additional cost, additional process of it. That's my point. My point is AI is not peninsula. It's important, but it's not the only solution. Yeah.
Yeah, that's a great point. SIna, what's your thoughts there?
I'll try to be brief just because we're gonna going to run out of time, and I think the points that Craig and Jeffrey brought up were really insightful in that when we talk about back office operations, if we're talking about patient engagement, or we're talking about identification, or even costs, as Stephen was saying, like these also affect outcomes, and so there's back office and front office are interrelated, and so I like Stephen was saying, I'm also really excited about this technology. I would say the one use case that I would add would be digital documents, which I think parallels what we're seeing in finance and other industries. I think healthcare by itself may be keeping the sort of the fax machine business in business because our dirty secret is we still 1 billion faxes a year are passed around between payers and providers and pharmacies, and each one of those needs to be looked at. It needs to be processed. We don't have a standardized forms. And so it's extremely inefficient. And so there's technology that's on the horizon that integrates computer vision and NLP to start to make some of that more efficient.
Excellent points. And I think we've touched on it a lot, but I'll move us into our next topic. We've touched on these, so I'd love to hear the thoughts here. Where is AI a challenge for the healthcare industry? And I'm going to start with Stephen, but I know SIna will have some thoughts as well.
This is a big topic. The way I look at it, I kind of cut it into 4 buckets. One is data. Quality of data is important. Garbage in, garbage out. There's no different AI or not AI, okay? So this data is an issue. The way data hungry, deep learning, machine learning require large amount of labeling is a perpetual issue. And data also including nowadays, we talk about linking different systems together, interoperability of different systems. Cyber security privacy is an issue here, okay? So data is an issue here. Second is people. Reality is I came from industry. Low-wage healthcare IT can hire people like Google and Amazon. We can't pay them, period. Okay, and so the healthcare profession, the industry have to be creative. How you can retain talent to implement such a sophisticated system? Maybe partner with them and whatever. I don't know the solution, but people is a major issue here. Third is I always think about is a business end of the day. Although we are talking about healthcare, end of the day is the industry, is a business. Return on investment and outcome measure is important. And also remember, change of regulations anytime could screw up everything we have done. So it's also an issue here. The lastly, actually, a lot of people talk about it these days is a legal issue and an ethical issue of AI. It's a new technology. We're not quite sure. I mean, how to deal with it, frankly. Compliances, for example, a company has the data doesn't mean they can do anything about the data, okay? This is not financial data, it's a patient data. We need to figure out how to deal with it. FDA regulation on intent use AI system is start forming it, but we are still in the early stage. What are the informed consent? We have no clue. And remember, a lot of bias in AI system, it become an ethical issue. I mean, you heard a lot of story, right? You use biased data to train the AI system. Of course, conclusion is biased. All these issues, I think we just handling. So these are challenge, data, people, business, and legal, ethical issue. I think at least we identify the issue, which is a good thing. Identify problem is 50% of the problem, solving the problem. Okay, that's my belief. Go ahead.
No, that's a great point. SIna, what are your thoughts here?
Yeah, no, I think Stephen captured it really well. I mean, our focus is the people side, and so we're finding ways to scale using an international group of experts. But there's regulatory issues. There's data siloing. There's legacy issues. And it's expensive. There's a high barrier to entry into this space, and those are all, I think, challenges that are part of what we deal with in healthcare.
Craig or Jeffrey?
Yeah, no, this is a tremendous list. Dr. Wong touched on a few of mine: data, business value, trust and ethics, certainly. And SIna, that's a good point too. I guess I would add the one other on my list that's worth getting into the conversation is just around the challenges associated with getting models and solutions into production, operationalizing them across large enterprises and getting them to realize value. So you have organizations like Gartner and McKinsey talking about more than half of models not even making it into production, and the vast majority of AI solutions not yet delivering the intended value. That takes a lot, just the piece parts, the model, the data connectivity, the integration into consuming systems for those insights, all the agents and skills. I call that the anatomy, of an AI solution, the physiology, how it works enterprise-wide, scalability issues. We touched on security and privacy and those kind of things, disparate systems, distributed networks. It gets daunting really fast. And then obviously the brain of the operation, how does it learn, and the feedback loops, those sorts of things. So by the time you get to, trust issues, we call all of this orchestration. So orchestrating all those components that it takes just to put a model into production as an AI-powered application is pretty daunting. And that's kind of our sweet spot is what we're helping large, or healthcare is a distributed network of disparate systems. So, to try to leverage a set of insights across multiple channels, that can be pretty challenging. That's what I'd add to the list.
Yeah, I think, from an embracement perspective, so if I went back to the question number 2 that Stephen and Zena answered about some of the clinical examples, the medical examples, part of the science that's coming out is when a human by himself or herself is doing something, there's a certain level of outcome. The machine has a certain level, but when you put them both together, it actually increases the performance and improves the outcomes. So one of the things I like to say is artificial intelligence will not replace providers, but providers who don't use artificial intelligence will be replaced. So I think it's really about engaging and embracing the tools to help the human aspect of healthcare.
Wow, I love that. You've got some very memorable things I need to jot down there. Thank you for sharing. So let's jump into our next question. For an organization first getting up to speed on AI, what might be a good first step? And I think SIna is at a unique intersection of technology and practice here. So let's start with you.
Sure. So, I think, Dr. Wong kind of spoke to this earlier. It starts with the business case. It starts with a needs assessment, a market analysis, a stakeholder analysis, and then building a business case. And I think that's true of all innovation and not unique to AI. The part that's unique to AI is the data. And then that's the other thing he mentioned, what data do you have access to? What is the quality of the data? If you're going to bake a cake, you're going to need flour, and that's where you have to start. I think once you have an understanding of that, then whether you build an ML team or you outsource, I think those are the next steps that I see folks typically take.
Awesome. And Stephen, anything to add there?
Nothing. I think we touch on, I think back office administration is the first angle to go in, the first step.
Perfect. All right. So Jeffrey, what's your perspective here?
Yeah, this one, we do, like I mentioned in intros, we've got a good half a dozen years of painting a picture of everything you could do with AI, and our clients and prospects pretty quickly can get overwhelmed. That inventory of use cases and applications can grow very quickly. So we develop methodologies to help prioritize those. complexity, speed to value, measures like that to try to help build out an AI roadmap. And what that's really taught us, I think, again, Dr. Wong touched on this when he said, maybe start in back office areas. I talk about extensibility. How extensible is an application? If, say, we start in one operational area, like predicting billing inquiries based on claim, EOB, and payment data, building out member and patient provider profiles to do that, prescribe personalized resolution to those service inquiries. I can now leverage everything it took to do that and extend it into benefit inquiries, or even light up other AI use cases like very basic care management or care optimization use cases, reminding patients or members about appointments or prescription refills. During COVID, those channels might have been virtual and used mail order pharmacies. But one use case then can beget several others and lots of the phases of each. So, how do those roadmaps build on each other? Again, from what we touched on in the challenges, acquiring the data that it takes to light up an application, and then all of the other channel integrations that it takes to realize value from those insights. So we try to help clients in those areas to really build out incremental improvement value from day one, but a clear path to multiple use cases, lots of applications in each one.
So I'd like to add something to Jeffrey's and say why there's slightly different between AI in the past informatics IT project. The problem of the AI, most of them are a black box, not explainable. And it's
Right.
back to the trust issue, in the sense that you don't see it. I need to trust your result. That make it harder for people to accept it. And secondly, is the challenge in hospital I mentioned before. Reality, the hospital IT wasn't set up for this purpose. It's not the right type of person. So you're facing a people problem also at the same time, besides explaining. So a transparent roadmap, lot more cases, make people feel very comfortable is very important, because the current AI is not explainable AI, it's a black box AI, the deep learning one. So I think this is an issue, we have to solve it. In AI community, we have start coming up some new theory about explainable AI. You probably see in the next decade, you take some time from science, go to practice, but it's coming that way. In the meantime, you have to just give them a lot of use cases around roadmap, just handing by hand all these things to do. It's no way out, right?
Yeah, I love all these comments. I mean, the one thing that I would say is, to get started, you got to kind of put your ego aside. This isn't about being innovative, being the first, being whatever that might be, but being the imitate is equally as effective. So I would say expand your network, tap your network. If people are doing something in Jeff, Steven, Zena's case, take that and try to bring it into your environment, into your system. You don't have to be the first to create something, but to imitate from somebody else and bring it in. That's one of the things I think healthcare is rather unique, is in many cases, our competitive landscapes don't cross. And so to have things offered up and shared across the country can actually go fairly easy. But you got to have the network, you got to listen, you got to pay attention, and don't be afraid to say, can I have that? Many of us, most of us would be more than happy to share some of the work that's being done in other places.
I love that. That's amazing. That's an amazing perspective. Anyone have anything else to add before we move on to our final question? All right, let's do it. So let's talk big picture. So the last question is, oops, sorry. Let me share that one on the screen. So the last question is going to be, what is the absolute cutting edge you expect to see when it comes to AI in healthcare over the next 5 years? I know Stephen already mentioned some things that we'll see 10 years out, but let's stay with you, Craig, for this one. Kick us off with this big picture perspective.
Yeah, this one for me is an easy one. I'm going to kind of default. If I went back 5 years and tried to predict what I would be doing today, how the industry would be, I'd be 100% wrong. So I think in terms of projecting the next 5 years, I really think we'll see some accelerated work. However, I don't think a prediction for me would be appropriate because I may be leading people down a path that may only take a year or may take 10 years. I really think the industry and our demands and the bright people coming in, we talked a little bit about some of the tech companies coming in, some of the retailers coming in, all that expansion of all that knowledge coming in to try to help us move our industry forward, because many of our organizations all have the same mission, I think will really help accelerate a lot of that work. So I'm going to balk out in terms of predicting. I'm just excited, what the next 5 years is going to bring.
That's fair enough. Totally understand that, but I appreciate you sharing. Jeffrey.
Yeah, I'm really looking forward to what our clinicians say to this. But as far as cutting edge, I mean, I think there's obviously going to be lots of improvement. 5 years is a long time in technology, let alone AI. But cutting edge, I think, as in areas like my own personal medical record, as a patient, a member, an employee, a consumer, having access to more of my medical record and being able to really help deliver personalized insights, be more proactive, predictive, all of the things we've mentioned here. I could see 5 years from now us starting to get to where we talk about almost a digital twin concept, almost a concept of another version of me that's digital, that includes data that I can't possibly remember myself, not just my chart, but and lab results and prescriptions, but again, insights, inferences, reminders, that sort of thing, a combination of lifestyle apps and watches and phones and IoT, home care, as well as everything all my clinicians, providers have. So that's one cutting edge area I could see 5 years from now we're starting to talk more about. And then the other one is all of that back office stuff we talked about, digital transaction processing, especially like we've said on this panel, borrowing from other industries, digital payments, real-time transactions, claimless encounters. That doesn't sound very exciting, but as Dr. Bari mentioned, being able to then have that actually improve outcomes would be pretty incredible. Not just the administrative and the financial sides of healthcare, but really have the data from all of those types of interactions, maybe feeding my twin and helping, all my clinicians take better care of me. And then lastly, obviously, we've got so far to go on the trust, responsible AI and ethical front. Getting to where their, solutions and applications have a trust index that a clinician looks at, knows how to read, like a nutrition label, and say, okay, I'll use this application, or I'll trust this score, that kind of thing. I could imagine in 5 years we'll be much closer to that in some ways.
Very exciting. I like the world you're creating.
Yeah.
Stephen, what's your perspective from the clinician standpoint?
Actually, from this is the third AI I went through. I went through 2 AI winters already. So, but this time I'm more optimistic. I think this time for real. Because the result, the way I look at it, we will continue to do deep learning, deep medicine or augmented medicine. Definitely keep going. We're doing that. In addition, we will also handle non-traditional data. You talk about not the text or the image. I'm talking about facial, your 3D video, your voice data, your behavior, your walking. This part of our health. AI is actually, the current AI machine learning is particularly good at that. You will start get this type of data into it. Physical exam is about understand the physical behavior of the physicians or of the patient, and then you can handle it. So the multimedia AI, I think you will see more in the next 5 years. And these were driving by the tech industry because they are good at that. And other area is SIna mentioned about the telemedicine, all these things. Well, actually, I'm thinking about you will see more intelligent virtual doctor, the next generation of telehealth. You're not talking a real doctor in the first pass. The current telemedicine is no different from one face-to-face. You still tie in a physician's time. He can only talk to you when he cannot talk to other people. And a lot of telemedicine is really about screening. You don't need an expert to be there. You can automate the process. If I look at stroke, for example, I can do NI scale, I can test it right there. I can fully using AI to automate it and send a score to the clinician who can spend better time in the bedside seeing the patient. So this AI for scale, next generation of virtual intelligent, maybe avatar, 3D avatar, you see a real person, real doctor, there's real SIna doctor in the face, well, if you're comfortable, but it's a machine behind it. It's not outside the question in the next 5 years, especially for a standard physical exam or physical therapy procedure. It's doable, can be done. So one area I can think about it will happen. Other area we have not touched on is drug discovery. Google recently come out a protein floating, which is get everybody excited. In fact, one of my postdoc now is professor in computational chemistry. Say now I'm out of the job. This guy already done the job. It's amazing that the AI with enough example, they can solve the decades-long problem with protein. I think there were a big area. It will accelerate our drug discovery process. Not drug development, it's still FDA human, but drug discovery definitely increased. The last thing I think we touched on a little bit, I like to be quantified, some passion about it, is really about equity in healthcare. AI inclusion in healthcare, I think this area that going forward, when data liquidity become more and more accessible, I think we need to worry about it from a social perspective. And I think we need to worry about it in a sense that, a simple example, look at Epic. Everybody hate Epic. Why? After implemented, physician complain about the burnout. They never, AMA come out, JAMA, couple paper about all these, they do all the document. We never even consider, even the real doctor, how they use the EMR. We just implement it because the government say, you have to implement it. So we implement it. And everybody complain, you don't want to leave, so go somewhere else, right? This is it's not very good for, I mean, the technology is not supposed to create a barrier. Technology is supposed to help. And so far we're talking about AI is wonderful thing, can help everything. Sometimes I worry about wrongly implementation of technology actually create barrier between patient and physicians. It happens in the past in healthcare IT before. I think it doesn't mean that the AI won't happen again if we don't care about it. So there are many questions about this equity thing, about the socio-economic behavior thing. I think we should pay more attention. You will see more and more coming. People talk about social determinant behavior data, depression data. These things is faster than what you think it will hit us. Once the data liquidity issue is finished and we just apply AI algorithm into it without consider that factor into it, I think there was disaster impact. So I just want to pay attention, people pay attention in this area.
Those are all excellent points. Thank you. And SIna, do you share the optimism of Stephen?
I'm glad to hear the optimism of Dr. Wong. He says the AI winter is delayed, and that's his forecast. That makes me very happy. Usually I'm like Craig. I try to stay out of the prognostication game, but to sort of speak to the bias that I shared before. The one thing I would add is what's happening in surgical robotics. I think that, when I was in training, the robot was in some ways a solution looking for a problem, and we saw some benefit in deep pelvic surgery, but it was largely an expensive toy. I could be candid about it. The intersection of computer vision with surgical robotics is, has the potential for being a breakthrough device. And, in 5 years, I could see it becoming where autonomous vehicles were 5 years ago. So, we're not talking about level 5 autonomy. We're talking about a smart system that will give you a heads up, before you cut a critical structure or find patterns in the way you're operating. So that's something that's on the horizon that I'm also really excited about.
I totally agree with that part. I think AI-assisted robotic is a good area, but I have one comment is not the current model of robotics. Current model is actually artificially create a barrier between physician and patient. Why, if you operate a patient, why did you go for a robot, not direct touching the patients? Remember, when the Da Vinci first started, it started with Army project. It's for telemedicine purpose. And in fact, the first experiment was done at UCSF and Stanford. We done on the pigs, Stanford operated on the pig at UCSF. That's the first experiment in the 90s, and that's tradition coming on. They serve the purpose. I think the next generation for you, the surgery, will be you are directly touching the patient through the robot, not through a middle robot. I think doesn't make any sense if you're already in the same room as the patients. So I will see a lot more agile robotics. Extend your arm, extend your vision, but much smarter. You don't have to worry about how to coordinate all these. They will do it for you, all these things. You may actually do the phlebotomy automatically, frankly. It can be done, right? Done enough cases, train enough cases, plug it in, guide the robot, reach the area. You decide whether it's correct or not correct, and then do the operation yourself finally. So I think the next generation of robotic will be get rid of robot in between. You become a robot with the AI.
That's incredible. And unfortunately, I know we could have a whole different conversation about robotics and surgery. That would be very interesting for another time, but we're out of time today. So we do have to wrap up. I just want to say thank you to all of you for your excellent perspectives here today. This has been incredible. And I mean, I know I've personally learned a lot, and I'm sure this virtual audience is giving you a huge virtual round of applause. So thank you all for sharing with us today. All right, thank you. And so for the audience, it's time for you to make your way to your next session. Along the way, make sure you accept your connection request and take some time to check out our amazing exhibits. Thanks so much, and we'll see you around.
Take care. Thank you. Enjoy. Bye-bye.